We'd encourage you to type your questions into the chat box. So we will have our speakers speak for probably close to an hour, close to an hour. So sorry, close to about 40 minutes or so. And then we're going to open it up for your discussion and to hear your questions, because we're really excited to hear your thoughts, your questions for the speakers, and also to engage in a bit more of a dialogue. So please feel free to type your questions into the chat box, and I'll be moderating those for the panelists. I'll do my best to bring your questions forward. We may actually unmute you and invite you to provide additional clarification or to participate in a follow-up discussion. And following the webinar today, you will receive an email with a survey link to give us your feedback. We do use this information to plan future sessions, so we're really excited to hear what you thought worked well in this webinar, what you thought we might improve upon, and also different topic areas that you'd like us to focus on, as we do run a series of webinars and want to make sure we're addressing all of your knowledge needs. It only takes a few minutes to fill out. It's only about 5 questions. And so if you could take some time to do that, we'd be most appreciative. So for those of you who I have not yet met or who are just getting to know our center is located in Ottawa, but we are a provincial center of excellence. We're funded by the Ministry of Health to support Ontario's community-based child and youth mental health agencies to deliver evidence-based services, because relying on what we know works, produces good outcomes in kids and families. So we have a really good relationship with all of the agencies across the province and are really committed to bringing them the latest knowledge on new topics and new issues of significance as we move through the pandemic in particular. So just a few words to get us started. We know that the pandemic is having a really significant effect on all of us in terms of our physical and our mental health. And for children and youth, there are particular issues that we need to be paying attention to. So some children who did have prior mental health concerns, they're not doing very well. They're doing actually worse than they were before because of the added strain and stress and uncertainty that's been accompanying the pandemic. For those children and youth who hadn't previously struggled, we're actually starting to see signs of those struggles. So we've done some work at our center. We're going to hear some of the research that's been happening through infant mental health promotion as well to get a bit more information about what those look like. What we do know is that these issues are presenting differently based on young people's age. So the experience of young people who are older, so who are in their higher years of high school, getting into university and post-secondary, they're unique kinds of issues. There are also unique issues for young people who are in their younger teen years, who are struggling with some of the things related to high school generally, and then the pandemic has sort of put an added layer on that. We also know that the experiences of children under 12 are unique. So all of the unique experiences that we need to be paying attention to, we need to be crafting unique responses to. So we're going to hear more about what that looks like at an agency level today. So we're going to hear it from experts working in the area of infant and early years mental health, so from research and from practice, who are working to support the unique needs of children under 6 and their families. And so I'm going to start by introducing I'll start with a territory acknowledgement. So we are located here in Ottawa at the center. I'd like to just recognize the history and strengths and diversity of Canada's First Nations, Inuit and Métis communities. We're committed to engaging respectfully with Indigenous children, young people and families within and across nations in what is known as Ontario. Here in Ottawa, we are on the traditional unceded territory of the Algonquin. So I'd like to take a few minutes now and just introduce our speakers. Nicole Willette is a first-time mom from Windsor. She's a board member at Children First and an engineer by training. And she also, like many of us, are missing being able to move outside of her home community and being able to travel around. So really excited to resume that. Also from Children First is Lori Kemp. Lori is the executive director at Children First in Essex County, which is an accredited multi-service agency providing services for families with children from birth to 6 years of age who are at risk of or who are experiencing mental health or developmental challenges. Lori has worked in children's services in mental health, child welfare, and developmental services for over 25 years. Laura Kapitanov is a social worker in the field of children's mental health and has been doing this job for almost 30 years. Presently, she's the supervisor of the intake and brief services team at Children First. And most importantly, she's a wife of 27 years and a mother of 2 kids, 20 and 24 years old. And Joel Schreier is a program manager of mental health and quality improvement at Children First. Joel has over 10 years of experience working with children, youth, and families in various settings, such as children's mental health, developmental services, child welfare, youth justice, and education. And excuse me, last but not least, Dr. Chaya Kulkarni is the director of Infant Mental Health Promotion, which is a professional coalition dedicated to promoting optimal mental health and outcomes for infants and children based out of the Hospital for Sick Kids in Toronto. Chaya is also an advisor to Dolly Parton's Foundation, the Imagination Library, and a member of the board at the Family Day Association. Chaya is also a part-time professor at Seneca College in the Bachelor of Child Development program. Prior to joining Infant Mental Health Promotion, Chaya was VP of Parent and Professional Education at Invest in Kids and has also served as a senior policy analyst and researcher for the Office of the Official Opposition at Queen's Park. So I want to welcome all of our speakers, and I'll ask Nicole now to kick things off for us.
Morning, everybody. Just get started then. So my name is Nicole. Maxwell was born on Boxing Day, 2019. So he was born pre-COVID. At the time when the pandemic, I guess, first started, my husband is working in healthcare and we didn't have a lot of knowns at the time. So we made the decision to isolate our family as a group rather than isolating my husband from myself and my son. So Maxwell basically wasn't held from March until June 28th by anyone other than myself and my husband. I think for a while that introvert side of me was okay with that fact of it just being him and I, and we were bonding and we were making all these steps together. It was also kind of okay with me to tell people that they weren't allowed to kiss or hug or be all over the baby for a little while. And I've definitely had friends that have had babies since COVID, and the introvert side of my friend group has definitely been able to feel that same kind of, it's okay, I'm doing well in this kind of environment. But as time wore on and that extrovert side of me started to really miss the social aspects of my life, it definitely got harder. And I have friends that are through and through extroverts, and they've had babies, and this has been really challenging for them to be able to stay positive and continue to maybe abide by all of the rules that COVID has encouraged, especially social distancing. Like I said, Maxwell wasn't held from basically 2 months until he was about 6 months. I remember the day specifically that we decided that my parents were going to be able to hold Maxwell again, and it was my dad's birthday. It was one of those days that it was exciting and heartbreaking at the same time, because I have 12 nieces and nephews, and I remember all of them going through that same stage of the stranger danger and feeling leery, but I never remember them feeling that way towards aunts and uncles and grandparents. I remember that being a very normal, natural part of their growing up. There was never any stranger danger that happened. And for my son, it was really hard to see that he was struggling and scared at the onset of being able to let everyone into our circle again. That being said, we're still trying to live by social distancing, but we ended up wanting that for Maxwell. And thankfully, since then, he has adjusted, and he's great with my parents, and he's great with my siblings. So that's definitely been, we're feeling less stressed about that now. But for me, the hardest part for the year that took place, it was definitely the lack of group experiences that my siblings all really felt like I was missing out on, and reminded me that it would have been so nice if I would have had the moms and babies groups, or the swimming lessons, or all the things that they were able to entertain during the year that they were off. And missing that was definitely one of those things that I didn't notice right at the beginning, but it wasn't until later on that I really recognized why that would have been helpful during some of these developmental milestones. So I look back now and I recognize how quickly the baby changes over the course of the year, and 3 months, they're doing something totally different than 6 months. So I was super lucky to have siblings and so many nieces and nephews, but they weren't in the same developmental stages. And I do really feel like you kind of forget what you're going through in that time period. So it was hard not having somebody to bounce ideas off of that was going through the same thing at the same time as me. So there was milestones that I'm not sure if they were necessarily delayed or anything like that, but I was definitely questioning, and I was unsure if I was maybe pushing too hard to see results, or that it was unnecessary worry, like babbling and feeding or sitting even, or pulling himself up. Those were all things that they change so quickly, and you kind of forget once they're actually doing it, but you worry at the time. But other than that whole, my side of the story and my fears, the ongoing fear I have now, I would say, is that I worry that he's not going to have the socializing and anxiety when he goes into certain circumstances like childcare in the future. I wonder if this will contribute to anxiety going forward around other kids, and if he'll feel safe. And I wonder if I should have been riskier from the beginning and allowed physical contact. There's always going to be that part of me that worries that time would have been essential for bonding. So that's all I got. Hopefully I've presented a case in which it's not normal. I'm sure there's a million other different moms that have gone through a million different cases, but hopefully it sheds some light on one experience.
Thank you so much, Nicole, for sharing your experiences with us. I think, to your point, absolutely. Your story is unique, but it's so helpful to hear what that impact has been on you. And it sort of reminds me that there are hundreds and hundreds of individual stories that we need to be paying attention to as we move through and post-pandemic. So now I'd like to turn to Chaya Kulkarni, who's going to tell us a little bit about what the research tells us about how families are doing right now and have been doing over the past several months. So Chaya, take it away. Chaya, you're on mute.
Yep, of course. So we did this survey in the fall of 2020, and it did go across the country, but certainly we had a heavier representation from Ontario. So definitely a very strong response rate from our province. And we surveyed, I think, upwards of almost 2,000 families. We certainly had strong representation from Francophone families as well. And certainly the response rate told us that families were waiting to be asked. And I think that's really important to note, is that families wanted to share their experiences. And for me, in many ways, these families with young children, under the age of 5 or 6, so birth to 5 or 6 years of age, these are unsung heroes. They're not families that we're talking about a whole lot, like globally as a society. We don't hear about what they're struggling with a lot. So I think the survey was quite helpful in that respect. Okay, so let's see. Sorry, Trace. There we go. Okay. Oh, I think it's a bit of a delayed. Okay. All right. So we know from research and decades of research, as well as everybody on this call. Oh, sorry, it's just really, Tracy, it might be better if you control the slides, because it's really not liking me doing it. So I'm gonna give.
Sure, I can do that, yeah.
Okay, great, sorry about that. So if you can go back to the second slide. Great, thank you. So we know from research, we know from best practice, all of you on this call are people who know this. Relationships are absolutely key during this period. So, certainly a silver lining is that families got to spend a lot of time with their little ones, but there was also a lot of stress that came with that. Entertaining young children 24/7, it is work. And we say a lot, parenting is hard. Parenting is hard on the best of days. Parenting during a pandemic is exceptionally hard for any age group, and certainly the families with young children. It is really, I think, very, very tough on them. I love the quote from one of the parents who responded to the survey. I worry a little bit about the impact of the stress on the relationship between me and my 2-year-old. My own frustration tolerance has been low, and so there have been times where I have reacted more strongly to challenging behavior than I would like. And just to remind people that when parents are stressed, we know this has a very decisive impact on the development of young children in particular. So, when families are feeling stressed because of the pandemic and employment situations, financial worries, this is going to have an impact on their child and how they connect and relate and respond to their young child. So next slide. So we asked a number of questions, and what you're seeing today are just snippets of what we learned. We are actually partnering with the University of Calgary, and they're doing a much deeper dive on the data. But we asked the following, we made the following statement and asked families to respond. I knew where to ask for support about my child's well-being and mental health. And so prior to the pandemic, it actually looked pretty good. Many families did know where to go to seek support, to seek answers to the questions. But there was a statistically significant drop during the pandemic, right? And this was before the second wave that we're currently in, and it dropped quite a bit. And again, the quote from one of the respondents, my biggest concerns are the detrimental developmental implications that my child will experience due to a lack of interaction with other children in a normal and frequent enough manner. I worry that this will also impact their mental health, right? So I think about, fast forwarding to when life goes back to normal and kids are back in school full time and everybody's, we're all healthy again. Are we prepared to support some of the challenges that some kids who have really not had any exposure to other children may present with? Are we talking to our education sector about this, our early learning and care sector about this, and preparing them for some of the challenges that some kids are going to possibly present with when life goes back to some kind of normal? Next slide. So we then put the statement out, I knew where to ask for support about my own well-being and mental health. And again, prior to the pandemic, this was looking pretty good at about 80%, but then it dropped significantly again once the pandemic set in. So caregivers reported a very significant reduction in their ability to find support for their own health. And even today, we're all online, we're doing this virtually. It's fabulous that we all have access to this kind of technical equipment that we can connect with people virtually, but that's not the case for all families. So it becomes very difficult for a parent who's seeking support for their own mental health. Where do they go? How do they connect? And how do they do that when they're caring for a young child, right? I mean, that's the other layer on this. How do you talk to somebody about your own mental health when you've still got to care for your little child? And this is where we start to see differences again, right? Because, for older children, you can step away and they can hopefully entertain themselves for a bit while you take some time for yourself with a practitioner. But for parents with kids in this age group, that becomes really, really challenging. So again, another quote, if I'm not okay, my kids aren't okay. And that's a very powerful statement, right? Postpartum depression help was virtually non-existent. My counseling stopped because I wasn't allowed to go in person, and there's zero chance of getting an hour to myself with 4 kids. So I really want to highlight this point, because for us at IMP, certainly, and I'm sure many of your agencies, we're really concerned about moms with very young children, with new babies. We know that across the province, many health units redeployed their staff from Healthy Babies, Healthy Children to other program areas. And I certainly understand the rationale for doing that. But I think moving forward, as we think about, making those kind of changes in service, we have to have a backup plan for these families, because there's a long-term price that families will pay when they don't get support. And I was just so aware, in some communities, HVHC has stopped providing any support, and midwives are now being asked to take over that responsibility. And this is hugely concerning for us in the mental health sector, that this is even happening and that these families are being left alone. Okay, next slide. So with those new moms, so receiving prenatal care over the phone, which concluded with negative health consequences, having to deliver their baby alone. One of my own staff was pregnant during the lockdown and delivered a baby and was pretty much on her own. And I think any of us who have had babies, we can appreciate just how challenging and maybe even trauma provoking or inducing that would have been for a new mom, that their baby may not receive postnatal checkups in person, delayed vaccination, and cancellation of new mothers programs, breastfeeding groups, postpartum depression therapies, all those support services that are so important. I think of every new mom as a vulnerable person in our society. They need very unique and exceptional kind of care and support. And what we are hearing, and certainly anecdotally hearing from practitioners across the country, is that we have not done very well with this population. We haven't been very responsive, and I don't know, I have not heard anything, in the news about paying attention to this particular group. So next slide. And again, just raising the issue around postpartum depression, which has, we hear about a lot now. I mean, the awareness is definitely much greater, but moms are suffering through this during this pandemic, and their support has pretty much been canceled. So we have moms experiencing postpartum depression with the absence of any support. Sorry, was somebody wanting to comment? No? Okay. So when it's untreated, and this is the part that's really important, and for those who are policymakers across the country, we really need you to hear this, because untreated postpartum depression has a long-term impact on children's development. And we know this, the research is really clear. It can lead to delayed cognitive and language development, insecure attachment, higher rates of behavioral problems, lower grades, and higher rates of depression in teenage years. So this is significant. So at the very least, we need to think about how we are, even screening for postpartum depression, and making, for those moms who may be experiencing some form of it, making some support available to them. Next slide. And then, of course, we can't lump everybody into the same basket. Rural communities are very different from urban communities. Many in our rural communities across Ontario and certainly across the country, internet connections are a big problem, resulting in challenges with virtual care. And the other thing I just want to mention, about that is, here, I mean, for us, and certainly, my colleagues who are on this call with me today, we got on at 10:30 so that we could make sure we had no technical issues. And if we had technical issues, each of us has somebody within our organization to help us resolve that technical issue, right? Think about a mom who's at home trying to access virtual care. Her microphone's not working, or the screen's not working, her baby is crying, and we've just now added to her poor mental health, right? So it's not as easy for everybody out there to be able to function through virtual services and supports. And there's just less that is even out there for families. And we know from this work that childcare was actually one of the most valued services by families. It's also one of the services that they are most reluctant to re-engage with, right? So there was a lot of support, I think, that families who used licensed childcare were getting. And the absence of that service being in place, or their reluctance to access the service, is causing all sorts of problems. So a quote again, being a twin mom in a small town is isolating during a pandemic, is very isolating. Internet connectivity issues in rural Ontario, slow speeds and lag time affected speech therapy sessions. So, another really good example of now, this is having a very real impact on development for young child. And all of us know the brain during those first 3 years, wiring profoundly. And so when there's poor wiring that happens in those first 3 years, it becomes difficult as kids get older to rewire those connections later on in time. It's harder for a child and harder for services as well. Next slide. So I will stop, and I'm going to pass it over to the Children First crew.
Can I just jump in just to say, Chaya, I think that I'm keeping an eye on the chat through the presentation, and there's so much there, just validating all of the things that the research had talked about. So really, although these are very troubling, good to see that there's consistency. People are experiencing these things. And so it helps us to actually know what we're dealing with when we try to craft services. So on that note, I'll shift it over to Lori and your team to lead us through your experience at Children First.
Thank you, and good morning, everybody. Certainly, just want to take a moment to thank the team that we've been blessed to be part of under this initiative, because we learned so much from our community partners. And certainly we are also wanting to honor the work of all the agencies who provide services to this population. And we know Children First is just one of many. So Children First in Essex County is a multi-service agency, and we provide services to families with children from birth to 6, and we're located in Windsor in Essex County. We are multi-service in that we provide children's mental health services, infant development, special needs resourcing, preschool speech and language, and we're also a subcontractor with the Western Autism Diagnostic Hub. We have speech language pathology, occupational therapy, social work, resource consultants, psychologists, and so we do have a number of services that we can offer to families and wrap around families. In the initial service disruption due to COVID, and I'm sure many of the other agencies did as well, we really struggled. We needed to take care of our staff who are so precious. We needed to prioritize their needs, but we were also conflicted because we also needed to take care of the children and family in our community. But we recognized at the front door that at the beginning of COVID, especially at that time, because we were really looking to plan short term. I don't think at the time anyone could imagine that we would be in a pandemic this long, but because we just didn't have any experience. And I'm sure some of you have heard the expression is managing the pandemic was like flying a plane as you were building it. And so we did what we thought was best at the time, and we prioritized the needs of our staff. We knew and recognized that staff also had children at home. They also had families and elderly parents that were being impacted by all of this. So they needed to have their cup full before they were able to take care of their own family and the families that we support. Maybe next slide. Maybe before I ask Joel to review this with the team, but Laura, certainly in supporting her team, she met and spoke with a number of families during the start of the pandemic. And I know that some of the examples that Chaya shared today were also examples that Laura had experienced. And we just really want to highlight and reinforce the voice of families. And Nicole was asked to join this presentation because at our board meetings, Nicole was the one who often said, but what about new moms? What about families with, with first-time moms? We don't know what we don't know, right? And so the perspective and voice of our families are so important. And Laura, could you perhaps share with the audience?
Sure. So good morning, everyone. A few things that we did notice right off from the beginning of the pandemic was an increase in referrals. We did have families calling, sharing a lot of stress and a lot of worry. Our email referrals, we do have a wonderful website. So our email referrals were also being utilized and significantly. We've seen an increase in that. And then the timestamp is really interesting about when parents are able to email us. So some of them come in the middle of the night or very late at night, stressing, the worry about their children. When Nicole was speaking, one family came to mind. It was more recent, but was thinking about this mom and her worry. So she had a little one. She actually emailed us on December 27th. So Sunday in the middle of the afternoon. And, thanks to Lori, our director, and our board, and I think Nicole was a big piece of that, we made the decision not to close during that week. And our management team was here to support families as needed. And it was evident as we had several referrals through the email on that Sunday. And I was able to respond to that mom with an email to let her know that, we were here and we were going to have someone call her on the Tuesday. So one of our supervisors was able to speak to this mom. And I was just thinking, Nicole, about all of those things you were talking about not having that exposure, right? That normal socialization with other friends, what's normal, what's not normal. So this mom had been sitting at home worrying about her little one, that he wasn't talking enough, and was on Google and searching up all of the things that possibly could be going on for her little one. So the supervisor did a fantastic job in speaking with her, really recommending that, to get off Google, to get down on the floor and just play with your child and enjoy him. And had some recommendations, and right away we were able to help her facilitate a hearing referral, set up a speech and language initial assessment, which I looked actually as, I believe, tomorrow, and connect her with one of our intake screeners. And when she spoke to her, which was only about, I'm not even going to say a week later, I was reading the note this morning, and there were significant gains that were made in the course of that week. This mom spoke to her about the improvement in language, some new words coming. She talked about them spending the bulk of their day just in face-to-face interactions. They were playing peekaboo and clapping and singing songs. They had decreased screen time, which I know a lot of our families are struggling with right now. How much, how little, and they had noticed significant gains already in this little one in a matter of, a couple of weeks, really. So I'm really excited to see what our speech and language pathologist sees with this little one. I believe it's tomorrow. And I hope that, again, some of those worries, right, not having that connection with some other people to know what is normal, what should we expect from little ones. So that's one that just came, you know, actually when Nicole was speaking, kind of stood out for me.
Thanks, Laura. And so we really tried to balance then, as we were seeing that the pandemic was going on longer, that we needed to pivot for families. And so our staff always have provided services to families in their home, if that's their choice, or in a community setting, wherever the family wanted us to be. We really wanted to reinforce to see the child in the natural environment for all of our programs. And so all of our staff had tablets or laptops with a Rogers card. And so they were reaching out to families the best way they could. And we knew that our families, we had also done a survey, so we knew our families were struggling. Many who were in childcare settings were, 50% had said they weren't going to return to a childcare setting. And so what did that mean for them? And how did we have to pivot our services in order to continue to support them? Because normally we're supporting the child in the childcare setting. Now we're supporting the child in the family's environment. We've never provided virtual services before. We were an agency, we had been talking about it before the pandemic, and this really thrust us forward in a very quick way. And so we relied on a lot of our colleagues in the community, including the Center of Excellence, to help guide that process. But our staff did a fantastic job, as many across the province did, in pivoting to support families. What we saw, and I'm going to have Joel talk a little bit about our referrals during the time of the pandemic, and that's what's on the screen too.
Thank you, Lori, and thank you to the whole team here. It's just been an extraordinary process to do this piece of work and take all of our experiences and sort of put it together for what you're hearing today. I would like to just draw your attention to the data that's here on the screen, and before doing that, I want to, Laura had made a point about referrals had gone up. And I think from the provider experience, it felt like it. It felt like as we went through the days and the days became the week and the weeks became, the month, we were experiencing just this heavy demand on our services with the phones ringing. But what was interesting was what the data actually says. And I was surprised. This is a big part of my role here at Children First, is to track some of this stuff and use it for some data-driven decision making. But as you can see, the data didn't really match initially what we were feeling that was taking place around us. So on the right side of the screen here, you can see what our last year looked like from March to December of 2019, pre-pandemic. And these numbers, we've ran them year after year. We have this over 3-year periods, 5-year periods. These are pretty steady figures. There's been incremental gains based on the introduction of new roles or things like that, but these are pretty steady and stable figures. And then when you cross over to the left side of the screen here, where you can see the decline that took place in our referrals. And so the teal bar shows our agency total. And I know that there's certain things that just aren't included here. This is the core of some of our programs. We had a reduction of 230 or so referrals for that year up to the agency. But then when we looked at the programs at the program level, you can see just a little bit of differences taking place. So within the mustard, custard type color representing our childcare, you can see that program experienced decline. And we probably can garnish an idea as to why. I'll talk about that in a moment. And likewise with our mental health program for children's mental health, 0 to 6, we've seen a decline there. And so I guess when we take a step back, and we've all heard it takes a village to raise a child. Well, what happens when that village all goes inside? And these children who weren't in childcare, weren't in school, we've seen the tremendous impact, which if we put real life to that, these were our children who were probably 2 to 3 years old in the yellow bar that were normally going to childcare that were no longer going to childcare. That can be explained. The gray bar would be a lot of our school-based referrals. Schools were closed. That can be explained. But the part that I think taps into what Laura was saying earlier was that drive for this feeling. Our entire management team, probably our staff, and I'm sure many of you out there in other communities and other agencies doing a lot of the same type of work, was this feeling of the infant child development referrals just kept coming. But that was unique to our community. Our community, that particular program remained intact, servicing under its original mandate. There was no redeployment there. But what about other communities where that may not have been the same experience? What about the hundreds and potentially thousands of children that are typically being served under that service? And the children that we've always prided ourselves on trying to get to children as young and early as they can be, for that early identification, early intervention. And now we're trying to establish strategies to where are these children that typically we would have been seeing. So there's certainly lots of takeaways from this very simple bar graph that does not present a whole lot of data. But I think in our own agencies and our own communities, I would challenge you all to maybe go back to your data, because this did not match what our feeling was at the time. And I think there's a lot of implications on service planning and the system level planning that needs to take place to make sure that all of these varied children needs and services are responsive to the current climate and what might come in the next several months and long term.
So which is interesting, I just wanted to add, when we looked at data over the years, and this is only a part of the year, it's not our full annual year, but the 107, 124, 130, 112, that's what we typically see in infant and child development. So the fact that that didn't, and we saw some families come back to say, you know, I'm spending so much more time with my child, here are my worries, this is what I'm seeing, or lots of questions just of uncertainty. So I think this is also our one program where we have the fewest resources allotted to it based on funding. And so as we proceed through the webinar today, there's merit in really reevaluating the importance of our infant and child development programs. And as Joel was saying, in some communities we know, because we're members of the Ontario Association for Infant and Child Development, that some programs had to be redeployed, right? And again, everybody, I think everybody was, flying the plane as they were building it. But is this something that we could certainly highlight for future waves, whether it's the wave we're in now or potentially a third wave where we could really reevaluate and focus on the most vulnerable?
Thank you, Lori. Much of this material, I'm not going to go one by one here, but I think there is some value in some of these sort of mini discussions, and some of it has certainly been touched on already. I think paramount for me was the top bullet point here: culture, communication, contact, and collaboration. And that really became dually focused. One on, I think, our organization and our staffing needs, but also our families and our community. And so really trying to preserve our culture, our service culture here at the organization, ensuring that we were having daily constant communication with staff to let them know as the plane was being built and things were changing so quickly, especially in the first wave, and maintaining contact and trying to just be available for families as much as we can, despite all the challenges that we knew they were experiencing on a daily basis. And just collaboration. I think our staff did a tremendous job partnering with the management team to do new projects, bring innovation, as well as collaborating with people and other organizations in the community. I know Lori will elaborate a bit further on that in a moment. And then filling the travel void. That was a massive, it was an opportunity, but it was a massive change for what we were accustomed to as a community-based program working in children's natural environments, and majority of our time spent in childcare settings and in community families' homes. Once that was gone, we had to rejig and kind of put something else in place to, one, make sure quality service was taking place, but that staff could continue to work and we can meet all those demands.
And I'm just recognizing a comment that Dolores made about working with moms and substance use. And it's a nice segue into something else we'll talk about perhaps later on in the presentation. But just know that that's on our radar as well. For solutions and implemented strategies, one thing that we did in trying to recognize, okay, what could we do quickly for our families? All of our staff connected with all the families on their caseload, but we also connected with every single family on our wait list. And what really, we knew that everybody was struggling. And so what could we do immediately to support those families, and what did they need at that time? And it went beyond just our services. We had one family who lost everything in a fire, and the staff our team of staff that was wrapped around that family really did support them. It was very appreciative, but it went beyond just looking at providing infant and child development services or mental health services. We really took a family approach to some of the work that we were doing. We did immediately pivot to social media, because that was one way that we could support families. And so on March 22nd, we created a YouTube channel, and our staff were just so excited about the opportunity to film different seminars and topics. And with our data, again, we were able to say, okay, these are some of the top presenting issues, and what could we do on social media to just share information with families. We see that now that maybe wasn't the most effective way to get information to families, because really our families who knew us or knew what Children First was, were able to access it. So we're really trying to evaluate how we're using Facebook. How do we engage families that aren't known to us? We created a new website, and we're really trying to leverage social media and connections in our community. Laura, do you want to talk a little bit about brief service?
Sure. So one of the things that, again, we noticed was the stress level of parents when they were calling us. For whatever the reason was that they were calling us, they were feeling isolated and feeling stressed. So one of the ways that we did pivot during this time was to begin offering each and every family that called us a brief service with our social worker. They would be able to have 1 to 3 sessions over the course of 6 weeks to talk to a social worker. And that was a service that we could give very quickly to families. And that was something that we felt really strongly about. And I know a number of families appreciated that. We had families that didn't need anything after being able to talk to one of our social workers, and other families, of course, went on for further services. But I think that was something that could be done quickly. We had pulled in some of our other social workers to assist with that as well as it was needed, and was a good response, I believe, to our wait list. Absolutely.
Sorry, go ahead, Joel.
Sorry, Laurie. One thing just to add quickly before Laurie adds, was with brief service, there really was no need too small or too tall. And I think that's really something I would like to emphasize is, families that are concerned that their child may have autism and these sort of clinical presenting issues that typically we may not have seen in our brief service. I think we, again, pivoted well, and we're very inclusive of all families just under that common umbrella of caregiver stress. So I just wanted to add that as well.
Yep. Thank you. And I think kudos to our staff who really took on other responsibilities. We had staff move into different streams. As an essential agency, we had the permission to redeploy, but when we asked staff, they would do anything. And that's just, I think, a true testament to the commitment and compassion they have for our children and families in our community. The wider system collaboration actually started a little bit before COVID in that because Children First is part of the Windsor Essex Ontario Health Team, I reached out to the adult table and said, is there a way that I could sit at the adult mental health and addictions table? You have parents who probably have children, and I have children who have parents. And so that was a great collaboration that has continued and really has grown through the pandemic. And so I have to say that working within the adult system and the ADAM system, knowing more about the child system has really been a unique collaboration and one that continues to grow. So I think that's all we have to offer right now. Oh, anybody working with child welfare, any impact there?
Yeah, that's just me asking. I'm just curious, right? I know that we're yeah, sorry, go ahead, Joel.
Oh, sorry, I thought I was on mute. I think certainly there's two things that we've seen, and it's come to the segments point, where certainly caregiver usage of alcohol and substances has been increased in terms of our experience. We are seeing much more referrals with those as presenting concerns, and tethered to that in that child welfare way, well, that you've asked, Chaya, is grandparents raising their grandchildren. Incredibly stressed out. I think the conditions of the pandemic and restrictions and the guidelines that caregivers of those demographics are experiencing are very different. And Laura could probably best highlight some of those stories. But certainly those are two trends that we're seeing that I think are going to have some lingering needs for attending to what we.
Yeah, I just, you know, we're working with a community in the northern part of the province right now. And even pre-pandemic, kids in child welfare weren't, like, nobody was really paying attention to their development. And we know when kids come into that system, they're traumatized. But what's really sad is this little person that whose situation we're working on was kicked out of kindergarten at 5, told that, you know, there had to be 8 days of no aggression to return. No strategies in place to help the foster parent actually support that. And it's just even taken a lot to know, like, was there a referral made because he's more than likely on the fetal alcohol spectrum disorder diagnosis track? But what we discovered after, you know, asking several times was that in fact no referral had even been made for an assessment. And in Northern Ontario, that assessment, the wait list, is 1.5 years. During a pandemic, I suspect that wait list is even longer. So I think that, you know, we've got a set of things happening for families who have their children with them, lots of stress, lots of challenges. And then we've got these children who are actually, you know, our responsibility. They have been taken into care, and their foster parents are really overwhelmed. Their kin, if kin are involved, are very overwhelmed. Grandparents are saying, you know, we don't have the energy of our, you know, 25-year-old who could have been parenting this child. We're struggling with all of this. So, you know, again, I just feel like this 0 to 5 and their families and caregivers are a group that need more from us, and as agencies, really to think about. And I love that when, you know, Windsor, Lori, the way you guys connected with your other agencies. And I love that phrase, parent, you know, kids have parents and parents have kids. And it's a real shortfall in our systems when we work in these silos and we don't come up with a collective response, right? So.
No, thank you, Chai. I was just going to add to Joel. I think the other area that we saw an increase in our referral types were kids children who had been exposed to partner violence. So we are seeing more of that as well in our referrals. Purnina?
There's.
I think.
Go ahead. I think Joel was going to jump in.
Sorry. Yeah.
No.
As well with. I just think the conflict that might be taking place within family systems has been exacerbated too, again, just anecdotally from our experience, where Our intake staff, who typically spend a little bit of time understanding custody and access and ensuring that we're inclusive of both caregivers and whatnot. There's been a much higher discord between those caregivers, or one caregiver with, again, just the restrictions that were put in place. A caregiver's just not able to have access with their child because the parent may not have wanted to take risks around COVID exposure or just their personal fears. So there's certainly just an intersection of all these issues and an untangling that almost needs to happen to better understand what these children's needs are now and how we can serve them down the road as we're still in this.
I think, thanks so much to all of you for sharing all of your wisdom and your experience with our group. I think what occurs to me is a couple of things. I think that, again, the uniqueness and the complexity of every single family system is really, really important to attend to. And so we know that parents' mental health affects kids' mental health, and kids' mental health affects parents' mental health. And we are in this unprecedented time when parents and kids are together more than ever before. And so it's not surprising to see these things, but certainly a good reminder to us that we need to look at the whole family unit. I want to shift now to some questions from the chat. There are lots of really great comments and questions in the chat. And so I'll kick things off by, maybe I'll just go through them one by one and invite whoever wants to just jump in and go ahead and share your thoughts on this. Laura Kilborn is wondering, sorry, everything just changed on my screen, is wondering about suspected, lots of referrals coming in for very young ones who have suspected ASD, so being identified on the autism spectrum disorder. She's curious about how the pandemic could be contributing to the lack of social skills that is currently being observed by parents and caregivers and doctors as well. Anyone want to respond to that? How might the pandemic be affecting, referrals related to ASD?
I can start us off if everybody's okay with that. I think one of the things that we're experiencing is a lot of those caregivers, it's certainly a testament to their strengths that they're continuing to at least come forward to our agency expressing their concerns and their needs under that infant development. But I think the pandemic, again, Laura alluded to it, there's vast amounts of screen time that in our age group, this population, it can be a contributing factor to potentially trick you into thinking there's ASD symptoms or presentation there when there may not be. I think that's certainly first and foremost. I think as well, Nicole alluded to something very important around sociability. Other aspects of our data collection using standardized tools suggests that of the kids that we're becoming involved within the childcare stream, that is those that are still going to childcare, that is becoming the #1 concern. So it becomes a twofold concern. Those that are in childcare, there's high rates of concerns about potential autism, but then what about the kids that aren't going to childcare, missing out on those socialization opportunities and those milestones, all those things which contribute to that brain development and attainment of milestones for bigger skills down the road. So I'll stop there and pass it over to anybody else that would like to give some information.
Yeah, I think screen time is a really big deal. And a really big challenge for parents who, for the last decade at least, we've all been saying, the recommendation for 0 to 2 is no screen time, and 30 to an hour for kids a little bit older, but with a parent. And I just can't see, realistically speaking, how parents can get through a 14-hour day without using a screen more than 30 minutes, even with a young child. So I think there's just like parents are facing all these contradictions now where, but we heard this was really bad, but now we're feeling like we don't know what else to do. And the reason this is so, there's a comment there about, can't remember from who, about speech and language services in your neck of the woods, Purnima, in Ottawa, and there's a demand and wait list. And I think we have to remember, let's connect some of the science here. We have this huge amount of brain development happening prenatal to 3. and the circuits for language are getting laid even before that baby is born, right? And then upon birth, like there's this rapid influx of synaptic connections that are being made to support language. And if our little people are not getting, appropriate and responsive language inputs, this is a huge problem. But I also just want to stress, sometimes those speech and language delays are actually very connected to mental health challenges, because children, again, they're having difficulty getting that response from their caregiver who's struggling with their own mental health. So you start to see this vicious cycle. And then when you layer on things like ASD, FASD, or any number of other developmental challenges the child might be having, the stress level and the impact is going to be, I think, exponentially greater because we're in a pandemic than if we were not in a pandemic.
Yeah, I was just thinking too, think about all of the families at home trying to work, right? So when we recommend, decrease screen time, and a parent is trying to work and utilizing the screen, right? And then we have these mixed messages, you're right, or kids that are on Zoom all day because of the classroom now, they're teaching online. So you're right, Chad, there's so many mixed messages. One of my probably favorite stories at one point during the pandemic was a dad who had called with those questions of ASD. I did my typical spiel, and we talked about screen time and face-to-face time and all those things. And a few weeks later, our speech therapist was meeting with the parent to do a speech assessment. And the dad said, well, I did what that lady Laura told me to. I sold our TV. So he literally, I think they had like a 50-inch TV or something. And he said, and it was a funny story, because then they started to, I'm like, I didn't tell him to sell his TV. I told him to decrease screen time, but he literally sold the 50-inch TV in their house, and they had seen improvements in their little guy and the interactions throughout the day. But that was one of my probably favorite stories.
I wonder also, the other thing that can happen is that sometimes, behavior can be challenging. I mean, it really can be. And if you don't have that strong knowledge about child development, what is typical for some kids can appear problematic to somebody who doesn't know, right? So I'm thinking all those sort of trajectories have probably shifted because of the pandemic, right? So where we would expect to see aggressive behavior go down between 2.5 and 3, maybe it's been pushed now to 3.5, because kids aren't socializing. They may not be getting the same kind of language inputs they need. And a parent might see that and say, my God, there's something really wrong with my kid. We must need a diagnosis, right? So there's also that sort of just extreme and frankly, probably scary for a parent response to how they're seeing their child's development unwind during this pandemic.
Chaya, I'd like to just put an exclamation point on something as well. A lot of these families, like we were talking very singular, and the plural issue. A lot of these families may have 2 or 3 or more children that all have developmental needs, or multiple children with autism. And it just becomes a further exacerbation of how much they're struggling when they're trying to manage more than one child. Not that it's a competition, but Laura had worked really hard with a particular family where we brought in 3 siblings, I believe, that all had high needs related to exposure to substances. And this was a trained foster parent, I believe.
Yeah, and that's actually the family I'm thinking about, where we're still waiting for the referral, is a foster mom who's got 4 kids under the age of 5, and 2 at least are probably going to end up with that diagnosis, right? So, it is truly like overwhelming. I've got, one of my team members has 4 children at home, and she's my hero because somehow she manages and she keeps going. And the team is just sort of rallied around being able to support her, understanding things. But I think, it really is very, very tough on these families, and no support, right? Like really no support, because what they need are boots on the ground, right? Which during a pandemic, it's just not there for them.
So helpful. There's a lot of comments in the chat box, and so I don't want to ignore anybody, but I'm going to just jump to one that is focused on the screen time. So again, lots and lots of warnings and concerns about the amount of screen time. But I'm also aware that many agencies have shifted to virtual care, and so I wonder if folks could speak about, particularly the Children First team. What does that look like when you're trying to provide services, which are very, very necessary, and you've had to now shift to virtual as part of your suite of services? I understand that, some services are delivered in person, but certainly some are delivered virtually. So what are the things that folks on the webinar need to be aware if they're providing virtual care to families that have little guys at home, or that the younger ones are the focus of the concern?
I think early on, we tried to standardize as much of those practices that we could to assist staff in having a framework that they could work within, as well as a framework that they can help families try to set themselves up as best as they could to work in, so that there was value in that interaction and services. And I had seen in the chat box earlier on, someone had made a reference around coaching and doing virtual coaching with families. And we've certainly, it was a shift to move intervention to not just be on a camera, but to actually do intervention through that camera or through the virtual means. So that was our focus right away. Privacy, trying to make the most conducive environment possible. Having a plan if you're disconnected. I think we've talked a little bit about just reliability of technology. Go ahead, Chaya.
I'm also wondering about, domestic violence. And we haven't really talked about that yet. But we know statistically across the country, domestic violence rates are going up. And I'm just imagining a virtual session happening where there's, a present threat in the home. And I know Dr. Diane Phillip at Sick Kids is actually doing virtual intervention. She shifted her entire practice to virtual with zero to 6. And somebody had raised this concern, and she said the reality is that threat is often there even when you're in a face-to-face setting. But I think, Joel and Laura, you guys may have some expertise perhaps to just flag for people here around how to manage those situations. And what Diane said is, when she sees something happening, she's still got the contact information for that family. So she can have somebody go over to the home to make sure that everything is okay. But I just don't want us to forget about that group, because for children, that's a super stressful home. And then trying to do the virtual care on this, the upside of that is that Dr. Phillip has noted that her cancellation rate has dropped to 0. These families actually show up for virtual care. It's easier for them than having to pack the kids up and go to an agency. So I don't know how other people are managing, supporting that really vulnerable population with young children.
So one of the things I'll say, I'll share with folks, and certainly Lori, Laura, Joel, feel free to jump in. We have been hosting a series of webinars, as you know, like this one, and producing a number of knowledge products for our stakeholders. And lots of them since the pandemic are focused on virtual service delivery, because the sector has shifted quite dramatically and quickly. And, laudably, very, very impressed with how quickly this has all happened, and people are still providing really high quality care. But one of the things that people have raised, Chaya, is a need to know more about how to support families that are considered high risk. So if there's an issue of suicide, self-harm, family violence, how do you actually provide support to that family when previously they might have been in front of you, and you might have had protocols and procedures. These need to be adapted for virtual care. And so I'll let people know that we do have some resources on our website. We have an introductory webinar that focuses on high risk care and sort of it provides a bit of a sense of how to support families when you're dealing with those kinds of issues. But we are hosting, and Tracy can put in the chat a bit more detail around this. In February, we're hosting a deeper session, a deeper dive into this with Doctors Darren Courtney and Allison Crawford from CAMH, who work specifically and exclusively in high-risk care virtually. And so, or not just exclusively virtually, but they do that kind of work with families who are experiencing those kinds of issues and have pivoted to virtual care for a large part of their practice. And so just want to put a plug in to folks that while the focus isn't necessarily specifically on birth to 6, certainly there are issues that could span across the child lifespan in terms of being just aware of some of these practices and protocols that you could put in place while delivering care in family situations that are not as safe as we would hope they would be. And Tracy has just shared, it's on February 19th from 12:30 to 2. We'll be opening the registration for that soon. So maybe I'll shift gears just a little bit, if that's okay. I think one of the things that you talked about, Lori, early on was around filling of the cup, right? So how do you take care of your staff? And I know that many of the people, I think probably most of the people on this call are service providers. We talked about caregiver mental health and how that affects children, how children's mental health affects their parents and caregivers. What about the service providers who are caring for the caregivers and for the children and themselves are parents, perhaps? How are you folks supporting your staff through all of this? Because this has been going on for almost a year now. And we've seen sort of peaks and valleys in terms of people's energy and adrenaline. How are folks doing now? And what are you doing to support your service providers as they're providing care to families?
It's a great question, and I would hope my staff feel that they are supported. At the very beginning of the pandemic, everybody worked from home and participated in a lot of webinar and training to help them feel confident in providing services to families. We were very flexible with all of our leave, so if they needed to take an hour off, they could use sick, they could use their vacation, they could use float, they could use whatever time they needed. If they saw a reduction in their caseload and they weren't busy, just take the time off. We instituted at the first wave, instead of a 15-minute break in the morning and the afternoon, please take a half-hour break, because we're recognizing that being on virtual and being on, and we over communicated with our staff at the first wave of the pandemic. I started the day every day with an email to all my staff and trying to relay accurate information. The leadership team, we met twice a week, and the management team met twice a week. We were checking in with staff, and some staff continue to meet twice a week with their entire team. We tried to be as responsive to staff in that we always provided services to the childcare centers. So even when our childcare centers were closed, we still had the emergency childcare centers. And so we asked for volunteers for staff who were comfortable wearing PPE and going into those centers. Again, we've been making sure our staff are aware of our employee and family programs, that assistance program that we have, and all the other services that are available in our community, because we've always sort of been on high alert. One of our community partners, our family service Windsor Essex, and our Canadian Mental Health Windsor Essex branch, they both have a pandemic response worker who's providing therapy to caregivers. So we make sure that our staff are aware of all the resources, virtual or in community, so that they feel supported. Lots of webinars. Our Ontario Association for Infant and Child Development also offered webinars on coaching through a virtual platform. And so again, we've been meeting as the Children's Mental Health Ontario. We meet weekly, and we share ideas of how we're supporting our staff and trying to be responsive. An idea, this last time we went into pandemic, I really didn't want my emails to be about the pandemic. And so we did a 30-day gratitude challenge. And so every day I sent an email with a theme of what I was grateful for, but certainly couldn't be more grateful for the collaborations of the community across the province and with all of you, but also I'm just so grateful to have the team that I do, because they've just been remarkable and how fast they pivoted. So we just provided all of our staff a 1-minute gratitude journal that they can continue to reflect on what's positive in their lives and things that we can be grateful for and share that. So.
That's lovely, Lori. That's really great. I get emotional hearing that. It's it's so obvious how much you care about your team and how hard you folks have worked to support. And I know that those kinds of, I think that every agency has a story from their leadership about how they're both feeling for their staff as well as working to support them. So really great to hear that. Thank you so much. I think one of the things that is on many people's mind, and we were on a planning call for this session, and Chaya referenced the third wave of the pandemic, which I had never heard that there was going to be a third wave, but it sounds like people are starting to talk about this. Can you folks describe for us what you think we should be paying attention to as we head into the third wave? So first wave was, again, lots of adrenaline, lots of pivoting, lots of, sort of work going into how to shift everything. The second wave, we've got some good practices in place. We kind of know what we're dealing with, but we're sort of dealing with increased numbers and fatigue, COVID fatigue. What's your sort of, if you took out your crystal ball, what would you see as coming down in the third wave? And what do you think we need to all be prepared for?
Do you mind if I'll start, because this has been on my radar, especially sitting at the adult mental health and addictions table. And now with our increase in referrals, we're seeing a number of children being referred to us exposed to substances in utero. And we see that in the media. We see that the increase in substance use, alcohol, but our own data is also reinforcing that our families are being very open and honest about the amount of use of marijuana, alcohol, and other substances during pregnancy. And so we are looking at Chaya and again, the Center of Excellence to help lead us in the best way that we can support these families. And at this point, because we're doing the best we know with what the information that we have at the time, we're wrapping around our social work, our speech language pathologists, our occupational therapists, and our resource consultants around this family, and really needing to look at it as a family systems approach, family therapy, and not just at the individual child and the presenting concern. So we're taking that approach. And we're also looking at increasing capacity and training with all of our staff on fetal alcohol spectrum disorder. We just did 2 sessions of training, and we brought in our community partners, because how important it is that we're working together as a community. So the House of Sophrosine is our agency that provides support to family or to moms who are experiencing substance use and may be pregnant. And so their staff participated in the training with us, and we know we have a good partnership with them already. We do the Circle of Security group with their families, and so that collaboration is going to continue. But the other piece is, because you asked me about staff, is the staff well-being. I'm a mom. I have 2 boys, one that just transitioned into high school, and I have a little guy with special needs. He's got epilepsy and he's got dyslexia. And so, everybody is feeling the weight of the pandemic. Plus, you're trying to care for your own family. Plus, you're trying to care for the children and family that you are supporting through work. And so we really need to be mindful. And plus, the increased incidence of vicarious trauma, the trauma that we're hearing that families are experiencing, and how that impacts all of us. So I think those 2 are big on my radar right now.
Great, thanks, Lori.
Yeah, I would like to add just just thinking about those new moms. And again, Nicole, your story has resonated with me. And we also have staff that have either recently given birth or are about to give birth, and really thinking about how are we going to reach these new moms, right? How can we get to them so that they have that support system and they know where to connect? I think that's really important in terms of that early infant mental health, and what are we doing as a province, as a community, to support these moms and families, dads, families.
Caregivers, yeah, I think that those are really, really great points, Laura. Now the research is telling us that this is happening. How are we going to sort of get ahead of this in this third wave? Chaya, any thoughts to add?
Yeah, and I just am, so first of all, like I was the one who threw that third wave comment in there, and I have to preface it with, everything is hypothetical during this, right? But actually, I think it's one of our colleagues in Simcoe has put up a good post explaining why there is talk about a third wave, and it is because of that variant. And I guess to me, You know, I think whether we believe it, want to believe it, or just don't, I would encourage agencies to think now about what could they be doing a little bit differently if we get hit by another wave, right? What could we be doing differently for families? And beginning that preparation now, right? Like we have the benefit of hindsight that we can use, as well as the benefit of kind of forecasting with a level of some predictability. I mean, the variant is growing. So I think that's important. And the other thing I would say is, I think somehow we need to get these stories out there. I really do. Like, I do feel that these families and their needs, you know, I think the local agencies, all of you on the street, you have all done, you know, a remarkable job within the limits that we are existing in to support the families that you're working with. But I do think more could be done. And I think that we need to get these stories out there so that our governments, our policymakers can really understand what this looks like in a person's home when there are young children or young children with special needs, because I don't know that they do get it. We have all heard so much about long-term care, absolutely like critical. But how many of us were thinking about long-term care 18 months ago, unless we were using it, right? But today, because of the light that has been shone on long-term care, I think we all come to a really different understanding of what those people in particular are going through. And I think in the same way, we have to somehow get some of these stories out so that the policymakers, governments can understand that we need their help. Families need their help. And we need a bit of support, different kind of support, to be able to really be creative about the way and the kind of services that we are offering to families with children, you know, prenatal to the age of 6. So I would just get everybody to think of, I feel like we need a little bit of a call to action package for people so that they can share those. I write letters to the editor all the time. It's like a hobby for me on the weekend. I did one last weekend because there was an article about postpartum care in developing countries and how hard it was for women in those countries, without a doubt. But my letter to the editor was, we don't have to go to developing countries to see this. We can look in our own backyards to see how this is unfolding. And maybe Nicole, I don't know if you heard from some of your friends or through the moms groups, if there's anything there that you could share about how, you know, it sounds like you've got a good support system, but I bet you had moms who maybe didn't, and what they were experiencing.
Yeah, for sure. I think it varies among my group of friends. Like I said, I have a lot of introverted friends and a lot of extroverted friends on both sides. I think have really been hit in a different way, and talking it through has helped a lot. As long as you do have other moms, as long as you do have services available like Children's First or organizations similar. But if you don't know about any of that and you are alone, and fortunately I'm not one of those, and fortunately my friends are not one of those, but I can imagine with new families from not from Canada originally, that would be extremely hard. Families that their loved ones are not in close proximity, so the technology piece is hard for them. Those are the moms that I would say, like Children First, when we had our board meeting, we discussed all these, and what Lori referenced from the very beginning of this seminar was the what should we be doing, and how should we be reaching out, and one of the factors that really popped into my head was, I can't imagine doing this by myself, and I can't imagine how many families are.
I think those are great points, Nicole. You know, the importance of attending to single parent families. I think there's a comment in the chat about how dads are much more involved now because they're able to be, I suppose, through virtual care. You know, making sure that we're reaching out to those in rural communities. But you raise a really important point, and that's about equity seeking and diverse populations. What do we need to be paying attention to in terms of reaching into those communities and making sure that they're getting the kinds of supports that are necessary?
With with Windsor Essex, we are known to have a very diverse population, and so we have connected with our Windsor Essex local immigration partner. One of our managers participates with the all the other service providers, and we go out to different early on centers where there's a high population of newcomers, and we make sure that we're a presence there. We work really closely with early on. So we'll have a developmental resource consultant and a mental health resource consultant be present in the center so that families become familiar with them and start to see them, and then we can build the trust in a very informal way. So when they do want to ask questions and need to ask questions, we're there to support them. We also have what's called We Value as another community initiative. And so all the newcomers who go through the YMCA process and connection, they do an algorithm based on the concerns, what services might be available. And so Children First is one of the services that would be known to all the service providers welcoming the newcomer population as well. So we try to do a lot of work. We don't do it perfect by any means, and we have lots of room for improvement, but we really have utilized the resources that are available for the newcomers to complement the services that we offer. So that's one thing that we should also, as service providers, be looking at, is how we can provide services to and recognize that, you know, autism isn't something that's translatable into Arabic. It's not, right? Mental health isn't always translatable into or seen or welcomed or perceived in the same way that we have. The stigma might be even far more worse than what we think of it in our communities. So how do we communicate that to families so that they see us as a support and not as a risk?
Yeah, and I think lots and lots of support for your comments, Chaya, about a call to action, right? People saying like, well, we need to get the word out about how important this area is. And that may also help to reach out to some communities that don't sort of know about the existence of amazing supports like the ones that are offered at Children First and across the province for kids that are younger than 6. I think that one of the things I'd like to do just in our last couple of minutes is just acknowledge all of the amazing strength and important contribution that everybody's made around this panel, as well as the incredible comments that have been in the chat throughout. I really want to thank you all for your engagement. There was a comment, Tina Benavides from one of our northern partners had said, you know, this is the kind of information that we need to get into the universities as well as we provide pre-service training to new clinicians, new service providers. You know, this is a great time to learn from, this is a very unique point in history, lots and lots of opportunity for us to, really understand what works and what doesn't work and try and rebuild our system in a way that, fits together well and is good at connecting across different sectors and across the different age ranges to make sure that we have a really good, solid, supports, a set of supports for children and youth across the lifespan, beginning, of course, with early years mental health. And even, as Chaya always reminds me, prenatally as well. Really, really important to remember that development starts right from the moment of conception and even before conception.
I would just sorry, what I will just add one thing. I'm in a highly analytical field. I really don't have to take my work home with me every night. And I just want to say the work that you guys are doing is incredibly emotional to me. And it really, really has affected me. And I hope that more people in the community that aren't in fields like you guys, I hope that the word does get out.
Thanks, Nicole. Really, really appreciate your comments and you sharing your story. I also want to thank Chaya for summarizing what is, I know because we're a partner on this study, it's a really, really complex, there's lots of complex findings. So really distilling that for us today was really, really helpful. Lori, Laura, and Joel, thank you so much for sharing, what's working on the ground and some areas that you're working on. And again, just Lori, to your comment about how you're working to support staff, there are tons of comments. I don't know if you've seen them in the chat, but your team is coming forth and saying how much they appreciate and value all of your support at this time. So just want to thank you all and all of you on the line for everything that you do every day for Ontario's children, youth, and families. I also want to say a special thanks to Tracy McLaurin, who's my colleague at the center, who has, she makes everything just so easy and everything's just been so seamless in rolling out these webinars. So just want to thank you, Tracy, and want to wish you all the best of luck as we move through this pandemic. There is a light at the end of the tunnel. There are several lights at the end of these tunnels, and we look forward to supporting you as you navigate those. So thanks very much, folks, and please feel free to check out our website for all of our resources. As Tracy said, this recording will be up there, and we'll make sure that the slides are up there as well for you to download. I want to wish you all a great rest of your day and a great rest of the week. Thank you so much for joining us today.